Hi, I'm Steve Selig, the founder of fittest, and in this short video I'm going to show you how fittest is ideal for handling abnormal heart rates or heart rhythms in response to exercise, including in applications for cardiac rehabilitation. One of the most frequent questions I get in relation to using fittest is really about this topic, that is, how do you deal with abnormal heart rates in response to exercise? And that can be for anybody, not just for people in cardiac rehabilitation programs. And it's usually what they're usually talking about are low heart rates. And I'm just going to show you in this video how easy it is to use low heart rates or even heart arrhythmias to use fittest to both estimate fitness and also to be able to prescribe exercise based on whatever criteria you pick. Generally speaking, though, I would say that with low heart rates, I tend to steer away from prescribing exercise based on heart rate because it does create a lot of inaccuracies and there's a lot of practical difficulties for the client in trying to manage their exercise intensities against a series of low heart rates. In a previous video, I talked about the updated guidelines as published by the National Heart Foundation of Australia, published in 2019 on the topic of a standardised program for cardiac rehabilitation. And it was directed towards health professionals. But if you're not a health professional, you can still access this guideline. And obviously you need to work in conjunction with exercise professionals. But one of the important things in the guidelines is there's a strong recommendation that participants in cardiac rehab programs should be given a tailored, progressive and supervised exercise training program. And of course, fittest is ideally suited to doing that. The next recommendation by the National Heart Foundation in Australia was that each client, when they enter a cardiac rehab program, should have a symptom-limited exercise test done, for instance, on a bicycle ergometer or on a treadmill. And they're the strong recommendations. And if feasible, peak exercise capacity assessment may be considered as well. Now, I'm just going to look quickly at these ticks. So what we need to do in a cardiac rehab program, and it really relates to this topic about low heart rates too, is we need to first of all assess our clients for exercise tolerance, and then we need to use that assessment of fitness to develop an individualised exercise plan for each client where possible. So we would then be able to tailor our exercise prescription, communicate that to both the client and the healthcare provider, which is usually the primary care medical practitioner. We can then use a fittest beautifully to reassess our client either during a program or at the completion of the program. Fittest is ideal for doing that. It does that really simply. And then we can prescribe further exercise plan and communicate that to both the client and the exercise and the primary healthcare practitioner. I've given you the guideline, the reference at the bottom. You can download from the National Heart Foundation of Australia to get these updated guidelines. Now, I want to come to the main topic of this video. And what we have, and this is slightly hypothetical, but it'll make the point really beautifully. The first we have is how I use fittest for clients with low exercise heart rates. Now, clearly here, you can see that this client has gone through a number of exercise stages, but heart rate didn't exceed about 135 beats, even at peak exercise. So it was a relatively low heart rate response, and you'll notice it's quite a flat heart rate response to exercise. And I'll be able to use fittest very simply by entering that final heart rate to get an estimate of VO2 peak, which clearly is linked beautifully to this data. So the point down the bottom is that a client with cardiovascular disease, in this case taking a beta blocker, Fit.test copes beautifully with these low heart rates. It's really, I wrote the app partly to be able to do this. Now, in the second example over here, we have exactly the same client with the same exercise data, but this time if you were to use another app, which didn't give you this control over heart rate, then you get this huge gap between the actual heart rates recorded during exercise and what the final VO2 peak estimate would be based on an age predicted heart rate peak, which in this case would severely overestimate this person's VO2 peak and make exercise unsafe. So if you're going to use these other apps, you've just got to bear in mind that people with beta blockers, it's very likely you're going to overestimate both their VO2 peak and overprescribe their exercise, which can make it unsafe. Now, the next examples I've given, on the left here, I have exactly the same client as I had on the previous slide, so I won't go over that again because this is a client taking a beta blocker. And on the right here, we have a healthy but unfit client with much higher heart rates, but actually theoretically putting in exactly the same exercise intensities for this client. And you can see here that for this client here, the estimated VO2 peak is about 28. And for this client here, a different client, but not taking a beta blocker, the heart rate responses are very different. They're much greater. You can see the slope of the heart rate graph is much steeper and going to a higher final heart rate, which is really, this is based on age predicted heart rate peak for this individual. However, the actual estimate of fitness is the same because these people achieve the same work rates on the cycle ergometer in this case. So this just shows you that fit.test is beautifully flexible for testing people with cardiovascular disease, say taking a beta blocker with flat and low heart rate responses to exercise, versus someone who has normal or fairly steep heart rate responses to exercise, and yet we can use them both to estimate quite nicely VO2 peak. Now in this example here on arrhythmias, this is an example of someone who has atrial fibrillation, and you'll see the heart rates are all over the place, but generally going in an upwards direction as the workload increases. And again, fit.test can handle beautifully these arrhythmias, these rhythm disturbances that we get, say in this case of atrial fibrillation. And although there's quite a lot of scatter of the heart rate responses, the actual linear correlation for this data set is still pretty tight at 0.974 and certainly valid enough to make this estimate of VO2 peak. Now, as I said at the beginning of this video, I certainly wouldn't prescribe exercise for this individual using heart rates because there would be far too much error. But fit.test copes beautifully with this because you have many other options for prescribing exercise that are not based on heart rates, and that's what I would do in this case. So that brings me to the end of this short video. Thank you for listening to this. I hope you're convinced from looking at this video that fit.test is beautifully set up to be able to handle clients with both low heart rates and also with heart arrhythmias or, for instance, atrial fibrillation. If you have any queries in relation to anything I've said in this video, please email me at info@myfittest.com.au, and I wish you a good day. Bye for now. Bye.